Hi there, I'm Anna and you're listening to 1K With, Kaleidoscope's latest venture, a series of 1,000-second conversations with a range of interesting people across health and care. And what is Kaleidoscope? It's a social enterprise that we've set up to bring people together to improve health and care. And a lot of our work focuses on starting conversations and talking about what's important. And this has led us to 1K With, and we're delighted to be joined by Richard Smith for today's episode. Richard was, of course, editor of the BMJ for 13 years and also chief executive of the BMJ Group. And we'll hear a bit more about what he's been up to since then shortly. But to fill our 1,000-second opportunity with Richard, we've asked him to share 3 moments throughout his life which have brought him to where he is today. And we'll also be asking a number of surprise questions from the bowl in front of us, but more on that later. So over to you, Richard, to perhaps tell us about what you've been up to and launch into your first defining moment.
Yes, well, I've been doing all sorts of things since I left the BMJ, but I suppose the main thing is I created a program together with a big American health group and with the National Institutes of Health to create centres in low and middle income countries to do research on non-communicable disease. And that led me to be chair of the board of ICDDRB, which used to be the International Centre for Diarrheal Disease Research in Bangladesh, for 6 years. And the main thing I'm doing now is running the Lancet Commission on the Value of Death. I'm a great believer in death.
Okay.
Death is a virtue. Death is a good thing, not a bad thing.
Interesting.
So and it's a normal thing.
Absolutely. So you've been reasonably busy, you could say, since your time in the BMJ.
Yeah, I do other things as well. So yes, I keep very occupied, although I'm retired, but I don't get paid for most of what I do. So let me tell you my first moment. It's when I was 14.
Okay.
And I had to choose which O-levels to do. And having a tendency towards extremism, I opted to do all art subjects.
Oh, wow. Okay.
And one of those was economics, which I hadn't studied before, but everybody in my school wanted to do economics because the economics teacher was so cool. And so they had more people wanting to do it than places in the class, so they picked people out of a hat, and I was thrown out. And I was so sort of annoyed and pissed off that overnight I switched to doing all science subjects.
Wow. Okay.
And then I began to think, how on earth do I combine, my interest in the arts and science? And that led to that sort of facile idea that somehow medicine is an art and a science, which in some ways it is. And that's what led me to medicine. But whether that was a good thing or a bad thing, I don't know.
Wow, fantastic. And so the out of the hat kind of picking seems to be quite a chance way of getting into medicine.
Yes. Well, oddly enough, people say that's how you should pick medical students. Instead of having a row of sort of old men picking who they think will be a good doctor, because doctors do such an extraordinary variety of things, you should just set some, I think, fairly low academic standard and then just pick people out of a hat. Would be I mean, actually, I remember one of the deans of one of the London schools advocated that would be a better way to select medical students.
Absolutely. I also think you have to pick at such a young age, don't you, in terms of, I don't think anyone can really know if they want to commit to a kind of lifetime of medicine at that young age.
Yeah, no, and I completely agree with that. I mean, my daughter, who's 27, is a medical student at the moment, and she did other degrees first and has other experiences first. And every doctor I talk to agrees that it's not a good idea to go to medical school at 18. We should have the American model if you do something else first and then go to medical school.
Absolutely. And then once you got to medical school, you're happy with your choice?
Yeah, I suppose so. I mean, it felt to me like a very anti-intellectual activity. It was a really mindless I went to Edinburgh Medical School, which was supposed to be the best, and I loved Edinburgh, and I still do, and I had a great time at the university. But the medical education was it just seemed to be learning stuff by rote. It was not a good way to learn. So, and we had a kind of rebellion, which I was very much part of, and sort of said, this is hopeless. This all needs to be reformed. And we had big meetings and we marched, but in the end we lacked a Lenin. We didn't quite know how to sort of make it happen, and we were brushed aside by the authorities.
Oh, that sounds like a whole other moment and story in itself. But shall we have a surprise question?
All right, we do it that way. Oh, I thought we were going to do those at the end. But let's have one of those.
One or the other.
So I pick one.
Yes, please, and then I'll read it for you if you like.
Have you ever published something you morally disagree with? Well, that's an easy one.
Okay.
Yes, I have, hundreds and hundreds of times, because I don't, something like the BMJ is about debate, discussion. It's not about imposing my view on the world. And I suppose the worst example that upset enormous numbers of people, we had these rapid responses in the BMJ, which were like electronic letters.
Okay.
And there we opted to publish everything that wasn't obscene, incomprehensible, or libelous. And one of the consequences of that, we published a lot of stuff by AIDS deniers, people who said AIDS has nothing to do with HIV. And there was a lot of it.
Really?
And that, I remember there was an article in Nature saying, this is outrageous, giving a platform to these people. But I believe very much in debate. And that's what science is about. Yeah. So maybe that was a mistake, but I've certainly published lots of things I morally disagree with.
Oh, interesting. I mean, when you look at today in terms of kind of, there's lots of stories around kind of fake news or people putting out opinions on social media and it kind of coming up as an argument and people saying that they shouldn't have a voice. And I guess what you were saying back then even was give a voice to both sides and see.
Yes, I can never remember the exact words, but there's a marvelous quote by John Milton in the Areopagitica saying, if it comes to a contest, truth is never defeated in the end.
I see.
It's much more poetic than that, but I can't remember it all, unfortunately. I should probably memorize it because I use it all the time.
Thank you. Shall we go into your second defining moment?
Yes. Well, this was in 1974 when I was at medical school. I started in 1970, I finished in 1976. And I was sort of disillusioned with it to some extent. I felt a hell of a lot of what went on was more for the benefit of the doctors than the patients. So I was feeling, and then I went to this lecture by Ivan Illich, who, was a hugely significant intellectual figure in the 60s. And I think in some ways has come back. And he gave this lecture at Edinburgh and he was surrounded by these desiccated sort of academic fossils. And he was this very charismatic individual. And he argued, the way I always say it is not quite right, but it's the way I remember it, that the major threat to health in the world today is modern medicine.
Interesting.
And that had a huge impact on me because his argument, his sort of core argument is that there will always be pain, suffering, and death. These are just part of being human. And a sort of job of a culture is to make sense of those things. And then in some ways along comes modern medicine and says, don't worry, people, we can defeat all these things. There won't be any more pain. We're going to sort out suffering, give us enough time, and we'll even sort out death. And ultimately, that's a completely bogus promise. Okay. And he wrote a book called Limits to Medicine, which I still read, and I recommend it to lots of young doctors. And it has a big impact on them. In fact, I would say a lot of the things he predicted, that, runaway health costs, treating people who are not really sick at all sorts of things he predicted have come true. And if you read in there, there's a lot about medical error. There's a lot about what subsequently in a way was called evidence-based medicine. Okay. It's a hugely influential text. And it was such an effect on me that I thought, well, I just can't, what's the point in going on studying modern medicine? So I dropped out.
Oh, really?
I remember he gave his lecture on a Friday. It was like a sort of religious moment for me. And I spent the whole weekend walking around Edinburgh, talking to friends, trying to make sense of all of this. And I thought, well, I have to kind of drop out. I can't go on doing this. So I dropped out on the Monday.
Wow.
But then I was thinking, what else am I going to do? And that previous summer, I'd done the kind of hippie trail to India. And I thought, well, I don't want to just sit on a beach and be stoned all the time. Yeah. So I thought, I am interested in how we deal with pain and suffering and death. So I dropped back in again on the Tuesday, but I knew that I was never going to go down the kind of conventional route, because in Edinburgh, unless you consciously sort of opted off the conveyor belt or got thrown off, you ended up as a general physician. Okay. And I didn't want to do that.
Yeah. And so that I guess 24-hour period of dropping out and then going back in, were your kind of tutors in disarray and thinking what's going on here?
They didn't know anything about it.
Okay.
Because it was the weekend. Yes, I mean, whether anybody missed me on that Monday,
Yeah.
I doubt it, because there were 150 of us. I don't think anybody were, where's Richard?
Yeah. Oh, so did you formally drop out on the Monday?
No. I just thought, that's it, I'm not going back. I didn't, write them a letter saying I've gone.
And these are the reasons.
And I suppose perhaps that reflected that I wasn't sure about it.
Yeah, absolutely. And then I guess from that point onwards, you had in your mind that you were going to get this medical degree, but kind of think about it as one step along the way.
Yes, exactly. And I thought, I can't see me doing any of the kind of conventional things like being a general physician or being a surgeon or being a GP. I wondered about being a psychiatrist. And that's in a way what led me to the BMJ, because clearly it's it's another space.
Yeah, in the medical world. Brilliant, thank you. Do you want to pick your surprise question number 2?
Here we go. Oh, well, it's funny that what one book should everyone read? Well, I suppose I've just answered that question in a way. I think everybody should read Ivan Illich's Limits to Medicine. He wrote other books. There's a sort of general thesis which is called Tools for Conviviality. He also wrote a book called Deschooling Society and Energy and Equity. And he foresaw, he was a critic really of industrial society. And sadly, I think, industrial society is destroying us. It's destroying the planet. So again, I think he was very far-sighted. He was a Catholic priest by background.
Oh, right.
Although I think I just finished reading Crime and Punishment for the second time yesterday.
Really?
And I think, there's another book that everybody should read. But there are so many books that everybody should read. That's what I spend most of my time doing, actually. Yeah. Reading matters more to me than anything.
Fantastic. That's quite a tough question, I think.
And actually, Crime and Punishment, in a way, is a book about, a man driven crazy by reading too much. And that's what my wife thinks happened to me.
Oh, really?
And Don Quixote is another sort of classic example of a man driven mad by reading too much.
Yeah, there's a slight theme in those books there.
Yes.
Let's have your third defining moment.
Well, I wondered about this one, and whether to relate it to a sort of idea or whether to something that happened to me. And I suppose in the end I opted for the one that happened to me. So in 2004, on the 4th of March, I was rung up by a friend who asked if I would like to, that's when I was at the BMJ, and asked if I would like to come and be the chief executive of United Health Europe. And my immediate reaction was, I'm not at all sure about that. I'm not sure that would work for me, but I do feel that you need to move on. And I'd been the editor of the BMJ for 13 years. Yeah. And I thought, perhaps I'm standing in the way. In fact, in retrospect, I probably was, of all kinds of developments. People shouldn't go on doing things for too long. Famously, all political careers end in failure. I'm going to have another one today. And I think if you look at it, almost all big jobs end in failure if you go on too long. And my brother, who's a stand-up comedian, says you always want to get off the stage, leaving people wanting more and thinking, oh, I wish he wasn't going. Not, oh my God, when's this guy going to go?
Yeah.
So I did leave, and I suppose that led me, after sort of a couple of rather uncomfortable years working with United Health Europe, which wasn't a good time. I then came to do this work creating centres in low and middle income countries. There were 11 of them, 4 in China, 4 in Asia, 3 in Africa, and 4 in Latin America. And I visited them all regularly, and I got to know all the people in these centres very well. And I was a sort of a one-man NGO, because United had given all this money, but actually no one was much interested apart from me. So I did my own thing together with the National Institutes of Health. And then that led me to working with ICDDRB and spending lots of time in Bangladesh. And it gives you another view on the world. Yeah. I sometimes wonder how many people in Britain have really experienced how life is in a low and middle income country. I know people go on holiday to Sri Lanka and India and such like, but often you're living in a little enclave.
Yeah, absolutely.
So I think it's everybody should experience what it's like to live in a city like Dhaka.
I personally would love to go. But do you think your time at the BMJ helped prepare you for this kind of next step in the journey?
Yes, I think it did. I mean, one of the things about being at the BMJ, and it was true of, so we had lots and lots of young doctors who would come for a year, including Fiona, who's the current editor, and lots of students who came. And one of the things I always observed is that actually, especially if you're a young doctor trying to do your exams, trying to work, you have a very, very convergent view of the world. And then you come to the BMJ and you sort of, wow, there's all this other stuff going on. So, you know, I'd traveled a lot to low and middle income countries. I remembered vividly, actually, when I was at the BMJ in the 80s, we published quite a lot of research from ICTDRB in Bangladesh. And in those days, we published virtually nothing from a low and middle income country. But this was done to a hugely high standard. So I thought, how is this happening? How's there's this extraordinary center in Bangladesh? And I realized actually in retrospect, I mean, most of the people there at the time were Americans. I mean, it was a sort of spin-off of Johns Hopkins. It was a creation of the Cold War.
Wow.
But it became more than that.
Yeah, fantastic. I'm conscious of time, so I'm going to stop my questions and move on to the surprise question, please.
Right, here we go. Why does the health world never seem to learn from its mistakes? Well, again, I thought about that. It's because it's so inward looking. It doesn't look out enough. You know, when you want somebody to inform you more about health, the tendency is to go to another health person. And it's just like people talk about the Westminster bubble. I think there's a health bubble. So I think, and I suppose another thing I could have chosen as something that affected me hugely is I spent a year at the Stanford Business School in the middle of my time at the BMJ, and that had a huge impact on me. Because I went really with a sort of traditional doctor's idea of management. Who'd want to do that? It's boring. It's all sort of strategy and words you can't understand. And I came back thinking the opposite, that actually to mix together people and ideas and resources to make things happen is tremendously creative and difficult. So whenever we would start a new journal, I knew we could do the editorial side quite easily, but whether we could, you know, do the business side, that was much more difficult.
Yeah, absolutely. And where else do you think health should be looking to? Other sectors?
Yes, yeah. I think to every sector. I think to the humanities, to social science, to business, to politicians even. I think, and globally. So think, and I suppose in some ways, people do look globally. Although when I see people sort of moaning about the NHS and we need more money, I think, well, goodness, I mean, look what people have, you know, only a tiny fraction of the resources that are available in the NHS are available in Bangladesh and other countries. And if we kind of thought more about that, I think we would be smarter.
Absolutely. Richard, thank you so much for joining us today for 1K With. It's been a pleasure. Thank you all for listening. If you'd like to see more from the series, please visit kaleidoscope.healthcare or join the conversation on Twitter using #1KWith. Thanks very much. Bye-bye.
Bye-bye.